Good afternoon, good morning, everyone, depending on where you are joining us from today. My name is Shadrach Opon, Project Manager at Africa Health Business. I will be moderating this session today. Welcome and thank you for joining us. Before we begin, I want to highlight some house rules that we have. We request all attendees to remain on mute throughout this session. This will be a 90-minute session, so we urge our panelists to observe the timeline provided. There will be pop-up poll questions during this session, so please take some time to respond to them. And feel free to tweet during the session under hashtag HBS2021. Let me also introduce Africa Health Business to you before we begin. Based in Nairobi, we are a boutique consulting and advisory service that aims to improve access to equitable healthcare in Africa. Through private lens sector, we provide organizations with actionable insights to grow their health agenda. On your screen are some of the top services that we provide. The following will be the format of the session today. So we urge the panelists to take up to 8 minutes of speaking and spare at least 2 minutes for the Q&A and parting short sections. Just to set the pace, allow me to give a brief highlight of the session. In the recent past, artificial intelligence has moved from being a futuristic promise into a reference point for innovation. AI is already making its way out of research laboratories in Africa. We can all see that the technology has already started transforming healthcare with great vigor. Even as the new coronavirus strain holds the continent in its grip, new tools for COVID-19 detection and monitoring are needed to combat the pandemic. Adopting new and alternative technologies that can detect and monitor COVID-19 could be an essential part of lessening resource limitations and decreasing the spread of coronavirus. AI is likely to play an integral role in this and other areas in healthcare. But just how can we leverage the opportunities for AI in healthcare for Africa? I believe there is need to address the main building blocks that are essential to delivering a sustainable AI for African healthcare system. There is need to touch base with issues around proper digital infrastructure for storage of data from health facilities. We also need a strong data culture within health facilities that values data and makes tools and resources accessible to clinicians. Suitable regulations and standards for AI and data science are also needed, which will enable regulators to examine AI applications within health before their deployment. I also believe there is a need for adopting local solutions by comprehending and finding suitable solutions while promoting self-reliance and assisting in cultivating the local ecosystems. But most importantly, there is need for a more targeted funding for the AI health startups in Africa that links entrepreneurs with corresponding financials and reducing risk for private investors. Having shed the light on this session, allow me at this point to introduce our panelists. The first panelist we have is Mr. John Kamara, who is Chief Inspiration Officer at Ada Labs. Mr. Kamara is also founder of Afia Record and Artificial Intelligence Center of Excellence. We also have Mr. Shadrach Anyuo, who is Solutions Architect Lead with Amazon Web Services. We have Dr. Turuti Mwirigi, Commercial Director at CarePay Limited. We also have Dr. Joan Correa in the panel. Dr. Joan Correa is General Manager, Health at Equity Foundation. And finally, we have Mr. Benjamin Mackay, who is Senior Manager, Technology for Development at Safaricom PLC. So at this point in time, allow me to bring in Mr. Kamara. Mr. Kamara, let me first congratulate you on winning the East Africa Com Inspiring Leader of the Year Award. You are doing a great job in that aspect, especially around Artificial Intelligence Center of Excellence. Mr. Kamara, we acknowledge the significance of data. We acknowledge the significance of data in AI and the sensitivity with which that brings. Just what do we need to do to ensure data protection and privacy for AI in healthcare? And maybe you can also talk to us about AI practical training, curation of data, and even natural language processing, and what you see this having as an impact in healthcare. Over to you, Mr. Kamara.
Thank you very much, Shadrach. I think, first of all, for the recognition of the award, I'd like to thank everyone because it's also part of my team that also helped to find and to get this award. But jumping right in with artificial intelligence, AI, machine learning in healthcare, one of the important things that we need to first address is the idea of curation of data. Because there is no AI with the right source of data. There is what you call structured, unstructured, and different types of data sets. And the biggest problem in healthcare when you start looking at AI is the data structured enough for you to actually learn anything intelligent from the data? So, and as we sort of begin to at AFIA Record and the AI Center of Excellence, when we start looking at institutions or data collectors and saying, okay, how do you collect the data? What do you collect the data with? And what is the purpose of the data on day one? Because when you're building these platforms as well, do you have in mind the kind of data structures and what you want that data structure to do for you before you then start saying, I want to build machine learning tools on top of that? And, I've seen in so many different places where, people build technology solutions in healthcare, but at the end of the day, when you then go back and say, okay, what can I do? Yeah, your basic analytics, you can do stuff like that. That's not anywhere near machine learning. And people always confuse, doing basic analytics work with machine learning. And it's the same thing, you're confusing a data scientist with AI engineers, two completely different sets of things. So one of the first things that I realized was that you found that most places, if we take Kenya, most health platforms or health facilities cannot participate in AI-driven healthcare as we stand, because the data structures that they have, the way they collect the data and the data set actually has no clear point in terms of what you want to do with that data. So the first thing you need to do is, how do I clean that data? How do I curate it properly? How do I make sure that is sequenced enough for me to then start thinking, okay, what are the outcomes that we can get from what we have? So that is the first thing that, as we go to different partners and talk to them, first of all, to understand. And the second part, obviously, is understanding what is it that you want to do with health data. If we look at Africa, Kenya specifically, one of the things that I find that's very interesting that we could do with health data is around precision healthcare. And when you're about precision healthcare, it means one of the problems that exists is we have very limited doctors and nurses in rural communities, right? Which obviously means those doctors are, they have so much work to do all the time. They're consistently overwhelmed, and the infrastructure. So if you're able to collect data properly and you build models that help those doctors in decision making, rather than taking 5, 6, 7, 8 hours to make a decision, these data platforms are able to provide you with quicker decision protocols, which then means I can then choose. The human element then comes in where it allows me to make that decision quicker, because now I have, a number of scenarios which would have taken me months to model. So that's one thing, one area. Then obviously when you also come into, especially a lot of people who use USSD phones, or a lot of our infrastructures here are also very, quite manually basic. You also see then, if you begin to digitize the healthcare data and you begin to also get patients involved, then you can start using that same information, building modules around specific type of diseases to start looking at preventive ways of actually solving some of the disease problems. So we're doing something with tuberculosis right now, where we're trying to say, well, one of the biggest problems in TB is actually misdiagnosis at the beginning. And TB is a very difficult disease to deal with. So we're collecting data points, over a couple of million data points, to start training a national, an NLP engine to say, how do we understand a little bit better what the initial point of contact for TB could look like in a patient, rather than it be treated as pneumonia and all these other things, and also how do those drugs affect the patient. So a lot of these things is really, really, really around the data sets on day one. And this is kind of what we keep preaching to people. So when we started training our 35 AI engineers, which is the first thing that we're doing at the AI Center of Excellence, is we're training them to understand how to actually go into companies and help them create the data layer of how they collect the data, first of all, before actually thinking about, I'm going to build an AI tool on top of this, or I'm going to build a machine learning protocol that's going to, and then think through what is it that I actually want this machine learning tool to do? Because it might not be, because the data sets you collect as well might not be enough for you to do much. So an AI tool doesn't live in silo. You can't just build an AI tool. And then obviously when you also want to build an NLP tool, or you want to train an NLP engine, or you want to go into deep learning, then you do need a ton of data sets that are properly curated. So the other part then is, when you're then also building this tool, is, are you building an engine that is biased to what you want it to do? So those are some of the things that, even as we work with big pharmas as well, trying to help them with things around, remote patient management and pharmacovigilance. How are you collecting data around prescription modeling, around the type of ingredients in the medication? How does that relate back to the patient? And then also the doctors in the hospital, can you also use that same data to understand how to provide better precision healthcare for the patient? So those are the things, to answer the first part of your question, that we look at when we talk about first data in healthcare, then AI in healthcare.
Thank you very much. Thank you very much, Mr. Kamara, for that kind of insight. I saw the first pop-up poll questions came in. Please do take your time to respond to that. And Mr. Kamara, I'm going to come back to you later on. But for now, let me invite Mr. Anyuo to share with us just briefly, based on what you've said, just what is AWS doing in the AI space? And Mr. Anyuo, if you can also talk to us a bit about the perception of AWS on the value of AI and machine learning, and how you feel this is transforming healthcare in Africa.
Thank you, Shadrach. And I love the conversation that the previous speaker had around talking about the challenges around data cleaning, processing, and modeling. And when you look at AWS, we are basically a technology powerhouse, and we do understand healthcare. We've been in this industry for some time. We have a combination of technology and expertise, and together with industry knowledge. And this has made us being able to not only being trusted, but also to be able to offer industry-leading technology within the healthcare space. Whenever we have discussions with our customers, some of the challenges that the customers come up with, or actually bring to our attention, are things like customers are looking at being able to offer value-based kind of care. But when you look at value-based care, it requires data for you to be able to make timely and precise decisions. Again, comes to the conversation that the previous speaker was talking about: data cleaning, data processing, and actually data modeling. But again, the challenge is, how then do you be able to clean this data, have data that you can be able to trust, and model it, write algorithms that are able to train themselves based on the data samples that you have, and make the right predictions. The other challenge that we do here is that healthcare data is inconsistent, it's incomplete, and at times complex. Basically, what this leads to is that it becomes very labor intensive to be able to extract information from these inconsistent, incomplete, and complex data sets. And apart from the challenges around extraction of information that are valuable to you to be able to make the right decision, then it also results into cases of having errors. Then with that labor intensivity, it results into physicians' burnout because of intense manual process that are required either in handling of this data. Basically, physicians get to burn out, and that also results into basically not being able to offer even the patients the right attention that they need. Then the other thing is around cost. The cost of healthcare continues to grow, and that's basically the world over. And it's time that we need to find better ways on how to be able to reduce that cost. The other challenge that we do here is around the management of the whole healthcare data framework, around having the right security mechanism, the compliance, and the availability of those data, being able to build the right framework and models that allows you to be able to open door into these data sets without creating a room for any form of data breach. And then the other thing that we've also had is, again, on COVID. COVID has forced the industry to quickly adopt. And I think there is no greater champion of digital transformation than COVID. And we are finding better ways to operate in very difficult situations. So the next thing is then, having discussed this, how then can AI as a technology or basically a means of helping the healthcare society or healthcare institutions or stakeholders to be able to address those challenges that I've talked about. One aspect where AI can be able to bring a lot of value is to modify or to modernize the care infrastructure. And when we talk of modernizing the care infrastructure, again, I come back to the point of data. How then do you be able to have cleaner data? How do you be able to manage this data? Because you get data in terms of documents, prescriptions that comes from medical personnel, be it claims, medical forms, and images. All these are a ton of information that you need to find a way on how you can be able to manage that. So modernizing the care infrastructure is an area where machine learning or artificial intelligence can be able to add value. Then the other part is around customer engagement. How does it increase customer engagement? And how can we be able to use AI services, things like chatbots, to be able to increase customer conversation, or how even patient and caregivers interact? And then the other one is around protecting patient privacy. And privacy is a critical concern for every healthcare stakeholder. And we can be able to build models and algorithms that basically reduce things around cybersecurity threats and increase the security assurance as the care providers interact. Then the other one that I think the previous panelists talked about is improving and accelerating diagnosis. When you have these tons of data, when you can be able to use that data to be able to build models, learn from that data, and identify hidden patterns or trends, then you can be able to increase the rate at which you are basically providing diagnosis. And we've seen this basically when you look at models that have been able to predict the reoccurrence of cancer or the existence of cancer cells within our human body. Then the other part is about managing population health. And when we can be able to develop better understanding of the health population, then that means that people who are involved in policy framework within the healthcare industry can be able to have more data-driven decision-making process powered by artificial intelligence or machine learning algorithms. Now, given all these challenges, what AWS has done is that, first of all, we've built a machine learning stack that provides the capabilities and makes machine learning capabilities to be more reachable to a greater percentage of the society. We've built a stack that allows people who are either data scientists, those who want to crunch numbers, those who want to build their own models to be able to use it with a lot of ease. We also provide frameworks that require that would allow people who really understand how to build these algorithms to be able to use. And then we also have AI services that you can basically plug in and start using. If I can be able to look into that in the next few minutes, we have something we call Amazon Comprehend Medical that basically helps medical practitioners to be able to understand medical context with advanced text analytics. We have what we call Amazon Transcribe Medical again, which automatically converts medical speech to text. We have Amazon Text Extract, and these are services that you don't need a greater depth of understanding of how machine learning works. The inner details of the algorithms is actually hidden away from you. It's basically a service that you plug in and give it your data, and it will be able to do anything that you want, be it around converting that text to speech, running text analytics on it, or extracting text and data from virtually any medical document that you have, or even using Amazon recognition to be able to automate medical image and video analysis. So we provided those services. They are basically readily available, and we provide them for people to be able to use and to shorten the gap that is required to be able to build those complex algorithms.
Thank you so much, Mr. Nyo, for that. And I will come back to you later on in this session and talking about the services that enhance patient access to care. At this point, I want to prompt Dr. Turuti to share with us his experience around MTIBA. Dr. Turuti, MTIBA is a real success story, and with many people continuously getting on board. How do you see AI impacting health financing? Are there any AI examples that are in healthcare financing? Maybe you can also talk to us a bit about what you see as opportunities within the value chain and AI foundation policy. Over to you, Dr. Turuti.
Thank you, Shadrach. I've been following the conversation on the chat, and I'll be happy to continue to answer the questions. I see the success of MTIBA, which is essentially a mobile-based health insurance platform that makes it easy to buy and administer insurance, has been a success considerably due to our partnerships, number one, with the likes of Safaricom represented here. And as Anyo was discussing about the solutions that they provide, they are also partners, and to some extent, their tools have been useful in this part of beginning to unlock and hidden patterns, which sometimes with the massive data sets would be challenging to see those patterns. So in our experience, as I said, we are trying to make it very easy for people to buy health insurance that suits them. So this is a journey. We see opportunities around there where behavior patterns, people's way of doing things would be, AI would be able to help people match better products rather than trying to force particular health insurance products to them. So we are seeing this part of the business where the technology such as AI, as we're talking about, would help with that. But practically where we've been able to implement, and that's the future, where we've been able to implement is around increasing efficiency in health insurance administration. And as mentioned, healthcare expenses have been rising significantly over the past few years. And the irony in healthcare is that unlike other industries, the technology that comes into healthcare actually increases the cost rather than reduces the cost. And this is for various reasons. One, there's a lot of opacity in healthcare. As mentioned, clean data to analyze trends or what is happening is not available, and I'll come to that later to explain why we see that as a challenge. But now what we have been able to see with our partners who we work with in insurance, where we digitize the administrative part of health insurance, from the member onboarding to the hospital visit to the digitized claims process to the digitized payments through our platform linked to M-Pesa, and the claims processing part, which is usually the challenge. One area in insurance that has been shown to increase the cost of care is that the fact that a claim turnaround would take anything from 60 to 90 days because it was paper-based, and it required quite a bit of human intervention to interpret the data in these claim forms and make a decision and do a payment as well. So with the MTIBA platform, we've been able to have faster cycles of payment, and we have implemented some AI technology to first enable claims assessors to make decisions, help them make decisions. So they based on the data sets we have and the algorithms that we have, the claim assessor can be directed quickly to know whether a claim either is an incomplete claim, whether there's inconsistencies with the claim, or even flag where there is possible fraud for the claim assessor to be able to make a decision. And we have seen this considerably improve turnaround time, faster payment for providers, and now discussions of can we now look at having better costs for our clients coming in. So we see those areas practically right now, and we know as we build the algorithms, as we build the intelligence into the systems, we know we can improve on that. I just need to put a caveat that everyone looks at AI as the end and all, and I think I'm happy to be amongst the panelists here who have quite a lot of experience, that it's not going to solve everything. We need to understand in what particular areas we want to implement this artificial intelligence or the different modules that need to be put in, so that we can measure outcomes and get to see the impact in the future. So what I'd like to say is we should not be looking at AI as a magic bullet, but it's as an important sector of technology that is going to improve greatly our healthcare delivery. Just back to the issue of data that has been mentioned, and it will keep on being mentioned, and I've answered the question in the chat. It is not an Africa problem, especially with healthcare data, for various reasons. One, the healthcare value chain is very complex with very many interconnected different specialities, and that makes it complex. The other is the issue of standards. We have been struggling as a global digital community in getting to understand what are the standards we agree on. That, for example, if you call TB, what is the standard coding, or what is the standard for TB, so that if it's TB coded in or the data is recorded in Kenya, it's the same as it would be done in Sudan. And you remember that we also have hundreds of thousands of medicines out there, so the data becomes quite complex, and the question is, how do we standardize that, and what terminology do we use so that even our digital health systems that are being implemented can speak to each other? If we're able to resolve this foundational issue, the likes of John and Anyo would have an easier time in building models that can help give feedback to this opaque data, can I call it data exchange that's happening in healthcare? Because the more transparency we create, the more we understand what is happening, the more we can direct solutions, which eventually reduce the cost. That would be mine.
Thank you so much, Dr. Toroti, for that. And I want to agree with you that we cannot expect everything from AI. And a lot of conversations are out here whether AI will replace physicians. I think we still do not have a broad understanding of what we can actually expect AI to do. There are a lot more that we cannot still expect from AI at this point in time in Africa. But talking about health financing, with the current high out-of-pocket payments across Africa, I want to bring in Dr. Joan Correa to just share with us her ideas on this. Dr. Correa, with your growing network of primary healthcare clinics you are currently running, yes, what do you see as the potential of artificial intelligence in healthcare? You can also tell us a bit more about what Equity Foundation is doing to achieve cost reduction while maintaining quality of healthcare. And I can also see pop-up questions coming over. You can take time to respond to this just as Dr. Correa is responding to our question. Dr. Correa, over to you.
Yeah, thank you very much, Shadrach. And yeah, maybe I can talk a bit about what Equity Group Foundation does in health and how we focus on the aspect of quality and costs, and our view in terms of how we can use artificial technology and other forms of digital health to help us achieve on those two aspects of the quality and the costs. Yeah, so Equity Group Foundation runs programs in various sectors of the economy. And I think to focus key on health, there's 6 sectors that we play in. And very quickly, I'll mention education, which is the largest that everyone knows about. We have work in energy and environment, agriculture, financial inclusion and entrepreneurship education, and social protection. So in health, our goal really is to drive access to affordable and high quality healthcare services. And how we do this is through modeling it, number one, because we felt it becomes very difficult when you're trying to say, for example, when you talk about the pricing for health services, make recommendations to other providers, for example, on how they're supposed to price their healthcare services. So how low do you go on pricing and while sustaining on cost? And so we did a proof of concept that ran for 3 years, running from 2016 up to 2019. With only 5 facilities. So we established what I'd call relatively high-end outpatient facilities, primary level, highest level of outpatient service, so that's level 3B. So apart from the general outpatient services, meaning doctor's consultation, lab, pharmacy, we also have the dental and the optical services at the clinics. Then, of course, the very simple procedures that can be done on an outpatient basis. So we ran only 5 facilities in the densely populated areas of Nairobi, and did that for 3 years, from 2016 to 2019. And I may want to say it was a difficult start, because initially our focus was on patients who would not, the non-insured patients who form around, currently where it stands around 80 or 80+% when you talk about the private and public insurance put together. So we're targeting the non-insured patients. And eventually, as part of it, we eventually realized that you really don't want to segregate or discriminate in terms of who can access. So we opened it to all, including insured patients. Ran successfully. Currently, we have 41 facilities as we speak today in 15 counties in Kenya. Yeah, and it sounds exciting, but we're not quite there, because we target a total of 1,000 facilities over a period of 5 years. And now when we talk about the aspect of digital health, for example, and even AI, where does it come in if we're going to be able to sustain on the aspect of quality and cost? I may want to indicate that, yes, so far we've been able to do well on that, because our average cost per visit stands at around 2,500 to 3,000 Kenya shillings. So 25 to about $30 per visit. And that includes all those services that we've talked about. Yeah, so, but now we realize, as I've indicated, for example, is that expansion is now getting, I think, slower. And even when you talk about outside Nairobi, where the need exists, there's a significant need. But then you find, because our model is a social entrepreneurship model, so it's a commercial model, franchised, where the franchise is the foundation, and the franchisees are former Equity Leadership Program scholars who are medics, who are setting up these facilities. So when you talk about it being a commercial model, the aspect of viability, commercial viability comes in, and it has to be a sustainably run business. And so when we now talk about the aspect of geographical access, how are we going to get our healthcare practitioners to establish their facilities in far-flung areas in all corners of the country, including areas where ability of patients perhaps to pay may be a bit challenging? And so you now realize that even as we go out further, we really will be called upon to embrace technology. And we've seen some of our facilities come on board to do that. We now have one of our facilities that's offering telemedicine services at their facilities, where you can actually have a full, you can have a physical examination remotely in consultation with your doctor, can physically examine the patients and determine what exactly they're handling. make your prescription, which they then dispatch to you digitally, and then you can pick up your prescription either from the nearest facility or the nearest pharmacy partners, for example. So we realize that in terms of going to such far-flung areas, we will need to consider the aspect of technology. But I think, as my colleague Dr. Toroti talked about, is the aspect of there's, I think, a slower uptake in terms of embracing this digital technologies or even artificial intelligence in terms of access to healthcare services. There's a bottleneck to it, and I think a big one is, number one, is the aspect of understanding what is it all about. And I had the opportunity to serve, I think, once as a practitioner offering a telemedicine consultation, and your patient, so long as your patient feels unsure about how the consultation will go and if they're going to get value for what they're going to pay for, yeah, then there's that aspect of it affecting uptake. There's also the aspect of skills shortages, which forces us, I think, to embrace the aspect of technology. When you talk about telemedicine, for example, when you have shortages of certain specialties, you essentially are limited in terms of choice. You have to embrace technology if you're going to be able to avail that service to your patients, yeah? But then the bottleneck, I think, also is the aspect of the capital-intensive nature of technology when it comes to health, yeah? So you have a solution that will work well, that will avail services to, you know, areas that probably wouldn't have been able to access this service through other channels. But who meets that initial cost of the establishment? Yeah, will you pass the cost to the patients? Dr. Toroti talked about, when we talk about digital solutions in health, somehow it escalates the cost of the service. So who meets the cost of that initial investment? Are you going to pass it on to the patient? Who pays for it at the end of the day? Yeah, and I think that's part of the reason why health has really been viewed as a social service. Yeah, the government, you know, probably needs to pay for that investment. It becomes a question of who will pay for that initial investment, whereas you're offering a very good solution. So I think in summary, when we talk about the aspect of, I think, digital health and its position in terms of making healthcare services more sustainable, we have to look at it in terms of the benefits for the whole tripartite pyramid that involves the providers and the physicians, the specialists, yeah, and then the payers. At what points can they embrace technology solutions, and what are some of these technology solutions that they can embrace? Yeah, and when you talk about the payers as well, if they're able to process, I think, aspects of payments faster, that contributes to lowering cost as well, yeah. And then on the patient's end, yeah, it's a very good solution. Yeah, patients has questions around how good is it for me? Am I getting similar service to when I have the doctor in front of me touching me? Because we have patients talking about the aspect of I saw my doctor, but the doctor did not touch me. Yeah, they feel they need to derive that value. So, you know, breaking that barrier. So you need to have it working in a balanced way when you look at it in that tripartite arrangement of the provider, the payer, and even I think the patient. So for us at Equity Group Foundation, we have realized that yes, even as we expand, we will need to embrace technology, but then we are now finding ways in which to ensure that this is going to be sustainable, and this will not result in a growth in cost for the patients. Because remember, our vision as we're starting out is that whatever solutions we're offering in health, really at the end of the day are supposed to lighten the burden on the patient's end, create value at the provider's end, and also encourage investments in health. So we look for solutions, digital solutions that will not escalate the cost is how we look at it. Yeah.
Thank you so much, Dr. Corel, for that. I want to agree that we need more facilities, especially in the rural areas. As you mentioned, the need is huge outside urban cities. I also want to agree that you know, the shortages of specialties is something that we cannot ignore at the moment. As Africa, we still have just about 3% of healthcare workforce. And even as we work on increasing the number of facilities, we have to agree that platforms such as MTBA would really be needed to facilitate just access to these services, because even if we have these services available, it is not a guarantee that you know, the patients will be able to access them at affordable rate. So just before we continue, I want to also say that we have another pop-up poll question on the screen. So please take time to respond to it. So at this point, allow me to invite Mr. Mackay to just share with us what Safaricom is also doing in the AI space. Mr. Mackay, there are a lot of anticipations about Safaricom Health coming into being. Is this something in the pipeline, and what is it likely to bring in the healthcare space? Over to you, Mr. Mackay.
Yeah, thank you, Pon. And I mean, quite interesting conversation. And basically, what I'll take you through is what Safaricom view is as far as AI is concerned. As you may know, for those who are in technology, the term AI, which is artificial intelligence, I mean, you find it being used together with machine learning and deep learning. I mean, all of them combined together, they can be confusing to a greater extent. And as innovators, we try to simplify and ask ourselves, I mean, how can we leverage on what already exists within our ecosystem to make a difference within the society we operate? We know the technology pertaining to AI and everything can be a little bit complex, requires technical expertise. And that's where partnerships comes into play as far as Safaricom is concerned. So to answer your question, what are we doing? I mean, one of the most important things is to solve a problem which exists within the societies we operate in. So crucial to this is to identify some of those issues. And once you identify those issues, in a shared value manner, we are able to ask ourselves, what data can we acquire? What data can we curate? And what new innovations or technologies can we integrate to make healthcare systems to sort of like come up with innovations within healthcare systems. Safaricom as an organization exists to connect people to people, connect people to opportunities, and also connect people to knowledge. So a bit in a small way, we've been focusing on certain pillars, and these pillars are like health financing, information dissemination, maternal health, and healthcare system strengthening. And the way we've been able to do this is partnering with organizations. You mentioned TIBA. We've worked very closely with CarePay. What was our role? Our role is more of that of gathering insights and leveraging on the assets which we have. We were able to identify the niche market which TIBA could focus on. And out of that, we are able to validate assumptions and say, like, this is the area we are going to focus on. This is the target group. This is the audience. We were able to measure their ability and willingness to pay for those specific services. There are other initiatives which we've already tried to sort of like pilot and validate assumptions. Some have been successful, others have not been successful. But what we do is to learn out of that. And as we learn, we are able to, in future, define better solutions which really can impact the societies we serve. You've talked of Safaricom play in the health ecosystem. As I said earlier, the purpose of Safaricom is to transform lives of our subscribers and Kenyans in general. And as we do this, I mean, we have to change the narrative. It's no longer business as usual, because basically our vision is to be a purpose-led technology company with a goal of being a digital first, an organization which is led by insights. And we are more of like an enabler. We want to come up with platforms which enable the ecosystem. And as we enable this ecosystem, we will need to partner with a number of other people or other players who are more experienced in the health space. So for those of you who are able to listen to our financial year ed, that is the FY21 results today, you had our CEO touch on some of these new emerging digital ecosystems which we are focusing on, agriculture being one of them, education, and health. So basically, the reason why we will be pursuing those opportunities is I usually call them the pockets of future in the present. We are trying to see how we can enable our subscribers, Kenyans in general, have access to good quality and affordable healthcare. The key thing is like, we can say it, but the rubber meets the road when the mechanics of implementing this are called into play. So it's through that we have to really ensure that we find a niche and come up with a proposition or a solution which really resonates with the people we are trying to target. And by the end of it, it must be purpose driven. Thank you.
Thank you so much, Mr. Mackay, for that. Those are very powerful insights that we have shared. I want to bring us to the Q&A section, some questions that have been popping up for individual panelists at this section. Mr. Kamara, if you can hear me, the first question that is directed to you, yes, what are some of the measures that we need to take to ensure effective data governance using machine learning? Mr. Kamara, if you can hear me, over to you.
Yeah, I'm still here. I mean, the first thing that you need to do is how do you handle the data even in hospitals as it is right now? The way data is handled is not in line with compliance. Because also compliance means that who handles that data even in the hospital? Right now, I mean, people keep talking about data privacy, but I am asking them actually go back to your current way that data is being handled. Is it actually handled in the most compliant way? Does the systems that are being built, does a nurse have the right to see my health record, certain parts of it? Does the receptionist have the right to see certain part of my health record? You know, what are the permission protocols that currently exist in the current systems that are there? So I'm always telling people, before you go too far into this privacy of data, actually understand the infrastructure on ground. Then the second part is, what is the laws around governance? And governance has so many different parts when you talk about governance of healthcare data. Who's governing the data? What is the value of the governance within the data? And what is the econometrics of the governance that the person who's actually handling your data uses to convert your data for information? So when you then go from governance, you're then going into privacy. Okay, what levels of data are privacy? Who owns what level of data? Okay, so if I paid for data in a hospital, do I own the data? How many people actually understand that you actually own the data that you paid for, not the hospital? But for years, you've been told that the hospital, but as long as the transactional value, when I pay for the data, I own it. The hospital has the right to use it, but it's my data. So I have sovereign right of ownership and sovereign right of access to that data. I can also decide who I don't want to give that data to next. Especially if it's not, then there's certain types of data under governance that should also, if somebody has HIV or things like that, there's also those type of data that has a different part of governance tied to it because it now affects population metrics. Then when you go down into residency of data, okay, where's the data residence? So many hospitals use software right now. If I ask them, where's the residency of the data? Because people talk a lot about data privacy. Can they actually tell me where the data of their patients is resident in? You'd find no, because you have all these software providers who provide you software anyway, and the residency of the data is not in country. So you don't even know what they do with that data. They tell you it's safe and secure, but what does that mean? So we can ask ourselves some really hard and difficult questions when we come to privacy before we even talk about AI in data. So once you understand all that, then you're going into the space, okay, from machine learning perspective, what are the modules that I want to build and how does it affect the right of the individual, even when I build these protocols to access this type of data? And when that machine accesses and learns this type of data, what is the use case for that access? And what is the use case for that processing that the machine has learned? And who gets the value of that data? Then when you look at data on the blockchain, the idea is that when you have the sovereign right of ownership around the smart contracting, you can see that somebody has used your data or somebody has had access to your data. That's why the blockchain and AI is probably the best way to look at data privacy. So these are some of the things that we need to sort of understand before you also start talking about governance. The privacy of data has so many different tentacles. So it's not just about privacy, but you got to break it down into little bits and pieces. And this is what we try to do at Afia Record, look at all the different elements of privacy, even within the health facility itself. I am a government official. I go to a hospital. The receptionist has access to all my health information. Who knows who she's telling it to? That's privacy. So yeah, so that is what I think in regards to privacy, governance, and then biased nature of the models you build on AI. Thank you.
Thank you so much. Thank you so much, sir, for that. And at this point, I also want to bring Mr. Nyo in this. I know we talked about we talked a lot around this area. So, Mr. Anyo, a question I have for you is: in this regard, what do you think we need to overcome or even do to harness AI in an ethical and inclusive way? Over to you, Mr. Anyo, if you can help me.
Yeah, thanks, Dr. Pon. I think I agree with John on what John has talked about around privacy. Privacy has it's a multifaceted thing, and he's talked about whose responsibility, where does the responsibility start and where does the responsibility ends. It's given an example of you walking in and the receptionist has all your data. Again, just to build on that, what I think needs to be considered is for institutions that are responsible for managing these data sets, what are some of the things that they put in place to be able to provide segregation of duties? For example, in terms of who access what, do they have the mechanism and the right technology to be able to differentiate the roles of every actor within the organization, and to what level of depth can they be able to reach when it comes to access to data? That's one. And the other thing is, do you have the capability to be able to audit? Do you have an audit trail that shows who accessed what at what time and for what purpose? That's also quite important. When you talk of the issue of ethical, I think it's also, I would also relate it to the privacy. It has several facets. To me, what I'll look at is what value, what challenges do you have or do we have as a society that needs to be addressed? And how can we be able to address those challenges? What are the positive things that AI can be able to help us address? And we've talked about the issue of how fast can we be able to identify a disease? How fast can we be able to come up with new ways of controlling diseases? One classical example that I would like to give is that when COVID pandemic started, one of the things that researchers faced was that there's already an exponential volume or increase in volume of information about COVID, which actually makes it very difficult for you to be able to have a proper insight, to drive insight that can inform treatment. Now, with AWS technology and basically built on Allen Institute for AI, which is a Code-19 open research dataset, we were able to basically build a model that allows people to be able to query COVID-19 open research datasets based on natural language, where you basically post in a question as if you are talking to a fellow human being. And the machine has the capability to be able to interpret that and provide you answers. And we have a service in the name of Amazon Kendra that understands the natural conversation, the natural language, and being able to respond to that. Now, when we look at that, what kind of impact would that bring? So to me, I look at it from the aspect of what is the value that we drive out of these new technologies, and more so when we talk of machine learning. And I do agree, there are people who are questioning to what degree do we trust machines? But to me, I would basically try to limit it to what value do we drive when we look at these new capabilities, and that are basically, to me, I look at them from the aspect of enhancing lives.
Thank you so much, Mr. Nyo, for that. And I want to bring Dr. Truti in this to just tell us, Dr. Truti, if you can hear me, just what is the one barrier that you see limiting AI at the moment?
So I think my co-panelists have mentioned it. The barriers, one is, as mentioned by John, data governance. And I would put that as how we structure the data, how we exchange the data between the technology platforms, and then how that data gets analyzed. So the data by itself is one challenge. Number two is, what are these standards? I'll go by, it's like repeating myself, but I think I'll just continue. How do we agree? What are the standards? What is the terminology? And then number three, as my colleague Dr. Korir has mentioned, from experience on the implementation side, is that we lack knowledge of the impact of AI, and also the expertise to implement AI. And I think that's where John is seeing the opportunity by building his organization to be able to create engineers who will be able to go into technology companies to help them now build this, build better to implement AI. So I think, as I've written in the messages, if we get the foundation right, from data privacy, how we govern this data, so that we allay any fears or ensure that the data subject, or as they are called in the Data Protection Act and in GDPR, have the control. They are the owners of the data. The patient, the end user, needs to know that they are the owner of the data. And once we sort that, and how the data is structured and how systems speak to each other, and then we get the expertise of the people to be able to now work on that data set, then we will have an explosion of new solutions, increased efficiency, and in my view, finally, a decrease in cost in healthcare.
Well, thank you, Dr. Turuti, for that. And I also want to bring Dr. Korir in this. Dr. Korir, with your experience in with running primary healthcare clinics, just in what segments within healthcare do you see AI showing some promise? Dr. John Korir, if you can hear me.
Yeah, thank you, Shadrach. And I think a key one, especially when you look at our approach at the Equity Afia clinics, which is a high volume, low margin model. So with our approach, what we find that is we quickly escalate numbers that are arriving at the clinics. I feel there's room to apply AI even before the patients arrive at the clinic, meaning to assist in surveillance and self-management at home. That's number one. So solutions that allow the patient to sort of self-triage, you can be able to input, for example, some of the very basic symptoms in terms of how you're feeling, and get some level of reassurance to know if you need to visit a facility probably in the first place. So I think it could start from there. There's that benefit. It would, again, decongest health facilities, which we would really benefit from that. Now, when we come to the facility level, I feel AI would be very useful, I think, also in terms of supporting the aspect of applying the management algorithms to assist in precision and accuracy as far as clinical decision making goes. So there's room for that. And then there's the aspect also of documentation, which remains, I think, a challenge sometimes in healthcare. We get reminded regularly that what's not documented was never done. So how can we strengthen the aspect of documentation? So I think speech recognition, for example, can contribute to locking in that aspect of documentation in healthcare. And then I feel the third one probably would be on rule-based systems in terms of diagnosing conditions, and probably relying on codes such as the ICD-10 code which can probably guide, for example, when you apply rules that tells you if you have, for example, this symptom and this symptom, but not this symptom, it excludes, for example, some diagnosis and hastens, I think, decision making. That can also be linked to the administrative process in terms of even when you proceed from the aspect of having offered the care to now seeking payments for those services. You can use AI to link that link that to perhaps insurance providers or the payers at the end of the day, where they can also input rules to say, for example, if you have this diagnosis, but not these, or, apply the relevant rules to guide, for example, what is payable and non-payable. It hastens that decision, and then will also hasten the aspect of how fast the providers can get paid. And then that way, I think also that efficiency can be passed back to the patient in terms of cost management. So I feel that's the way in which AI can play to contribute to lowering costs by ensuring a very efficient system, right from the points at which the patient is seen to the aspect of the precision in their diagnosis, to the aspect of their claim being managed, the providers being reimbursed. It could really ensure efficiency in the system, which translates, I think, to cost management and a lower cost at the end of the day for the patients. Yeah. Thank you.
Thank you, Dr. Correa, for that. And I also want to bring Mr. Mackay to just respond to this question. We cannot avoid talking about COVID-19 at the moment. So, Mr. Mackay, if you can hear me, just what role do you see AI playing or can play in COVID-19 response, especially in respect to low resource settings? Over to you, Mr. Mackay.
Thank you. I mean, when you look at it from where we sit, I see 4 areas where we can play a crucial role as a telco company. One of them is detection. And when we talk of detection here, we are thinking of, I try to call them use cases. Some of them have been done in other markets and in other countries. But you would find that you can leverage on AI to detect COVID-19 cases through early warning. You are able to detect anomalies, and those sort of like digital smokes, if I can use that word. There is also an element as far as detection is concerned, whereby you can think of diagnosis in terms of like imagery. So if you look at it, some of the CT scans, if you have systems in place which are able to sort of like depict what is happening in those images, they should be able to send some signals. The second bit is prevention. And basically, when we talk of prevention, we are thinking of issues to do with prediction, the probability of infection. I mean, a mobile network operator can leverage on location details, and as we do surveillance, we did a solution called Safiri Smart, which was more of like even before the COVID came into place, but partnering with Korea Telco, we could use it to sort of like alert our users on emerging issues to do with the flus and those kind of stuff. So basically, you can also use it for information purposes. And I mean, we are doing it currently through the 719 code, which is Safaricom partnered with the Ministry of Health. And you can personalize this news and demystify some of the misconceptions which are passed around as far as, or rather, which are shared around as far as the pandemic is concerned. And ensure that people are getting the right information. And the last one, not the last one actually, the other one would be response. Yeah, I've seen in some countries whereby they're using drones for delivery of essential commodities, materials. Robots are also being used to do temperature checks and everything. And also automating the service whereby people are able to do like a virtual triage, and you can also have chatbots, which can also be used for people to sort of like communicate and get some insights pertaining the pandemic. And finally, it's the recovery phase of the same. I mean, you are able to sort of like monitor how are we progressing, and I mean, both in terms of like economic recovery. So looking at the assets available to an organization like ours or a telco in general, those are some of the areas I think AI could be leveraged on. Are we doing some of them in Kenya? A bit in a small way, like the one for information dissemination, the toll-free lines, and those are the use cases which can really be looked at, and you can also try to build commercial models and business cases to see whether they are viable to scale, or you can sort of like do them in a bigger way to have meaningful impact and make commercial sense.
Thank you, Mr. Mackay, for that response. I believe there are a lot that AI can do, especially in COVID-19 response. Look at what Philips is doing in South Africa right now with a technology that monitors and detects COVID-19, and which is already actually enrolled out in over 11 facilities. I want to believe that those are very potent and comprehensive responses that we've got for those questions. And we already have
Can I just add something? Can I just add something before you?
Yes, Ms. Anyua, just go on.
Yeah, there's a comment around. However, somebody wrote, however, the question remains: what happens to all the data collected that IT vendors can take advantage of? I would like to basically highlight that technology provides mechanisms upon which you can be able to have control over the data that you either push to the cloud for this either for analytics purposes or to be able to work with already existing machine learning services, right? And one way of doing that is that you can be able to encrypt this data using your own private key, and then use that data in the cloud because you have the capacity. Because the cloud offers you the capacity to be able to accommodate that data and run the models on top of it. And anybody who has access to that data will not be able to read that data technically, because the keys that you've used is actually stored with you, which is off the cloud platform on which you're taking the data. So technology has better ways on which you can be able to control the accessibility of the data that you either ship offshore for you to be able to take advantage of the capacity that comes with something like cloud computing.
Oh, thank you so much, Mr. Anyua, for that response. During the session, there were some poll questions that were popping up on your screens. We already have the poll results with us. So the first poll questions that came up was, what would make Africa health systems AI ready? I see majority of us think that we need clear government mandate and policies on AI. Policies that would govern the foundation of AI in the respects to even data collection. Some of us also think that we need to deal with AI in ethical and social, respectfully, in a way that respects, every individual that is involved. The second question that we asked was, in what ways could AI bridge the shortage of health workers? Majority also thinks that, look, we need supportive diagnosis and treatment, as well as monitoring of patients. This is some area that AI can actually be of essence. Another segment of us feels that, hey, why don't we have AI decision support systems within our facilities? The third question that we asked was, what was the role, or rather, what role can AI play in helping Africa achieve the UHC? As we all know, this is a priority to almost all African countries right now, and different countries are in different stages in rolling out their UHC. But all our attendees feel that, look, we do not need any specific option that we need, that we provided. We need all this. We need pharmaceutical and medical research knowledge. We need equitable and unified provision of healthcare. We need to expand access to care to underserved or developing regions, and affordable healthcare, something that we've talked about during this session. So at this point, also allow me to give just our panelists a few seconds to give us one sentence parting shot as final remarks on this session. So I'm going to have to bring in Mr. Kamara first. Mr. Kamara, what will be your parting shot for this session?
I think my biggest pattern shot will be, first of all, it's been a brilliant session with a lot of really insightful thoughts and comments from everyone. And you know, some of the things that have been said makes a lot of sense into what we're trying to do. It's really that Africa has the opportunity to really leapfrog the world with AI in healthcare. Because one of the things that we produce so well, it's data. And also we don't have so many of the jurisdictional problems, the over compliance problems sometimes that, stifle innovation that, a lot of the Western countries have. So we can actually use the value of data we have to create value in our healthcare system if we learn and if we're intentional about how we collect data, not just about building health digital platforms, but on day one, while you're building these platforms, while you're curating these platforms, do you understand the data structures that make sense around, real machine learning and some of the outcomes? It might not happen today, but it means we're ready, because the cost of going back to re-implement these things, even when you have implemented digital healthcare, but it's not AI-driven healthcare. It's two different things. Having digital healthcare and having AI-driven healthcare are two different things. And we need to develop the AI engineers because we don't have them here. So I think, everybody listening, part of the job is to be part of the capacity development for AI engineers so that we can actually participate in AI-driven healthcare. Thank you.
Thank you so much, Mr. Kamara, for that. Let me bring in Mr. Anyo to give us his final remark. Mr. Anyo, in a sentence or so, please, what will be your parting shot for the session?
First of all, thanks, Dr. Pon and HB team for organizing this session. I think it's quite insightful from the feedback that we are getting from the team and everybody who's logged in. One of the things that I would like to say at this point is that, again, one of the challenges with adoption of machine learning and AI as a whole is the inadequacy around expertise. As AWS, we have team skills, we offer hands-on training, we offer training and certification. And I would basically just urge anybody who is interested in learning about machine learning, we have programs, reach out, and then let's see on how we can be able to help you scale your skills within the AI machine learning sector. Thank you.
Thank you, Mr. Anyo. Dr. Turuti, your parting shot?
Yes, my parting shots will touch upon what my co-panelists have brought about. Very insightful discussions, but mine always starts with the foundation. If we get the foundation right, and as John has mentioned, we have the possibility of leapfrogging other areas of the continent. And when I talk about foundation, it's essentially policy, data governance, and how we ensure that the data structures are correct. Also mentioned is the expertise, if you get that on board, because we don't know what we don't know. And last but not least, with digital healthcare is partnerships. If you can build the partnerships beyond what your area of expertise is, this is one area we can build on AI.
Oh, thank you so much, Dr. Turuti, for that. Let me bring in Dr. John Correa. Dr. John Correa, what is your takeaway from the session?
Yeah, thank you. I think, first of all, I'm grateful because I think this is one of the opportunities that have part of these discussions around digital health and specifically the AI, to be very specific. It's good to be having this discussion. It's one of the positives that have come with COVID that are forcing us to think outside the box. Yeah, how can we offer health services? What are other ways in which we can offer health services? So it's an opportunity that lies within the pandemic. That's one. And I think the second one, very briefly as well, is when we look at the aspect of AI, it's not a question of I don't think it's a question really of capability or, you know, the usability or the benefits of AI. Those ones are very clear. But as Dr. Turoti has said, the aspect of getting the foundation right is very key. And how we can work at getting the very soft aspects right. The elements of trust, especially from the patient's end, to be able to adopt some of these technologies. But the benefits, I think, are very clear. We've demonstrated how they support on aspects of precision, decision making, and which translate to quality at the end of the day, and also how they trickle down to our cost benefit. So let's get the foundation right and the soft aspects of trust, especially around the data, and I think it'll give us a good starting point. Thank you.
Thank you so much, Dr. Correa. Oh, Mr. Mackay, you are parting shot for the session.
Yeah, thank you for having me in this session. And basically, what I would say is that technology has a number of jargons. We will talk of AI, we will talk of machine learning and everything. But the most crucial bit is being able to solve a societal issue. So if this technology can solve an unmet need within the society, be it for commercial purposes, be it for philanthropy purposes, then we will be able to feel the difference and the impact of these technologies. So as we even embrace these technologies, we need to be more purpose-driven, make sure we identify those needs in the society and try to solve them sustainably. Thank you very much.
Thank you so much, Mr. Mackay. Those are very great remarks from our panelists. And I also want to say that it's always a great pleasure, working together with you. We are looking forward to always engaging you and having side discussions ahead with you. So at this point, allow me to thank all our event partners, without which this session would not have been a success. Also, please save the dates for our upcoming webinars. Our AHB and Africa Practice is collaborating with Africa CDC on 18th May to have a joint webinar on accelerating vaccination in Africa. On 16th through 17th June, we are having another webinar on improving access through telehealth. We are also having another webinar on 16 to 17, which is embracing digital technologies to foster innovation in healthcare for the well-being of East Africans. And finally, in our very own HB series, this is a must attend session. Please save the date on 24th June with equally great panelists. Our Managing Director, Mrs. Malos Kibache, will be moderating a session on the power of partnerships. Let me once again thank all the attendees and the panelists for joining us today and having this great discussion. In case you have any questions or inquiries, please reach out to us through the contact details on your screen. Thank you very much and have a great rest of the day and evening. Bye-bye.